Welcome to the 2023 Open Enrollment Meeting. Open enrollment is the one time per year that you can make a change to your benefit elections without having a qualifying life event. When I say make a change, this is the time of year that you can add or drop dependents. This is the time of year that you can change from one medical plan to the other medical plan. Open enrollment starts October 17th, 2022, and goes through October 28th, 2022. Benefits elected during open enrollment will be effective January 1st, 2023. These benefits will remain in effect through December 31st, 2023, unless you experience a qualifying event. What happens if you need to make a change during the year? If you have one of the qualifying life events listed on the screen, marriage, birth or adoption of a child, you or your dependents lose other coverage. These are all examples of qualifying events that would allow you to make a change to your benefit elections throughout the plan year. However, you must notify your HR team within 30 days of that event date in order to make a change during the year. If your 30-day window expires, you will have to wait until the next open enrollment to make any changes. Employee Assistance Program, referred to as an EAP. An employee assistance program can help you with a variety of different things. Maybe it's a stressful relationship at home. Maybe you have an issue with an older adult parent that you're needing help finding elder care for. Maybe it's a financial or legal issue. Maybe you've lost a loved one. All of these are examples of what an EAP can help you with. There is a great resource online. You have unlimited contact with the EAP through the phone counseling services, available 24/7, 365 days out of the year. Plus, you have up to 3 face-to-face visits per issue free of charge. The EAP is a great resource for you and your family members. And as a reminder, there's no charge to you, and it's 100% confidential. We will be staying with Blue Cross and Blue Shield this year for our medical. We will continue to have 2 HSA plans and the PPO plan. As a reminder, the HSA plans as well as the PPO plans both have the exact same Blue Cross and Blue Shield nationwide network. All 3 of the medical plans cover preventative care at 100%. And all of the plans include coverage for virtual visits, or another term is telemedicine. Specifically, the $1,500 deductible PPO plan has a copay for office visits as well as prescription drugs. This PPO plan is going to have the lowest deductible option. You have 2 HSA plans to select from. With the HSA plans, all services go towards the deductible first. The HSA plans allow you to open up a health savings account that you can put your own tax-free money into, as well as get free money from your employer that will be deposited into your HSA. The HSA plans are going to have the lowest premium deduction from your paycheck. The plans have stayed exactly the same except for the $2,800 HSA plan. We have had to change this to a $3,000 HSA plan in order to stay in compliance for IRS and HSA compatibility purposes. So your $5,000 HSA plan, again, exactly the same as it is currently today. You have that $5,000 annual deductible per individual. Once you reach that deductible, the plan picks up at 100% for the remainder of the calendar year. As a reminder, you have a very generous employer HSA contribution on this $5,000 HSA plan that we have listed on the screen, and you can use those dollars to pay towards your deductible. In blue, we have the $3,000 HSA plan. So this was the $2,800 HSA plan, and now it's bumped up to a $3,000 HSA plan. Again, once you reach that deductible, Blue Cross and Blue Shield picks up at 100% for the remainder of the calendar year. And you also have a very generous employer HSA contribution that's made on your behalf, depending on what tier level you select. The $1,500 PPO plan is a $1,500 deductible. However, once you pay that $1,500 deductible, Blue Cross only picks up at 80%. You're responsible for the remaining 20% until you reach your out-of-pocket maximum of $5,000. On this $1,500 PPO plan, there are co-pays for certain services such as physician visits, urgent care, and prescription drugs. This next slide goes into more detail on how things are covered across all three plans. I do want to point out things like major diagnostic. If you're going in for a CT scan, PET scan, MRI, it does not matter which plan I'm on, even the $1,500 PPO plan, I have to meet my deductible first, and then that co-insurance would apply on that $1,500 PPO plan. I'd still be responsible for 20% of those remaining charges. Great news, your rates are staying exactly the same. There's been no changes to these rates. The HSA contribution staying the same. So it's fantastic news to know we can go into 2023 paying the exact same prices that we were paying for 2022. Where to go for care? If it is a life or limb threatening event, please go to the nearest emergency room. However, we often find that people are using the emergency room for convenience purposes. There's a lot of other places we can go for care, and it can save us significant dollars. You'll see the cheapest option is MD Live, and that's going to be our virtual visits through Blue Cross and Blue Shield. Even if we're on one of the HSA plans, this is a great opportunity for us to save dollars if it's not life or limb threatening. And you'll see office visits, then urgent care clinics, and then the second highest place to go is the hospital-based emergency rooms. But the most expensive place for us to go to care is freestanding emergency care. There are a lot of these freestanding ERs around the nation now. They look just like an urgent care facility, but they are an emergency room, and they are going to typically charge you more than a hospital-based emergency room charges you. Again, you have virtual visits on all three of the medical plans. If you're on the PPO plan, it's $25. If you're on the HSA plan, it's a $48 fee. A virtual visit allows you to talk to your doctor and see him or her either on your mobile device or computer. Typically, they take about 10 to 15 minutes, and they can prescribe a medication if necessary. We listed some of the common conditions that are treated by a virtual visit. If you haven't already registered through MD Live, encourage you to do so. As a reminder with the prescription drugs, especially if you're on the HSA plan, encourage you to shop around for those medications. You're going to have to pay 100% of that contracted rate for that prescription drug until you reach your deductible. We would think that the same drug would cost the same amount regardless of which pharmacy we picked it up at, but that's just not true. They do have different contracted rates. So we've shown you the steps to go through Blue Cross and Blue Shield to be directed over to Prime Therapeutics, where you can search for your medicine, compare pharmacy pricing, and find which pharmacy has that drug at the best price for you. Another thing to consider is if you're receiving a new medication, ask your doctor if he has samples for that medication. That way it gives you some time to shop around and also to make sure that medication is going to work best for you. Don't forget that we do have the mail order vendor as well as the specialty medication. Blue Access for members is a great tool for you to use. You can either log in through the website or you can download the app. So much information to access. You have the provider finder tool. You can print your ID card. You can look at your explanation of benefits. They even have a cost estimator tool. Encourage you to download the Blue Access for members if you have not done so yet. There's a great 24-hour nurse line, free of charge, that we're available to use to us. Again, it's 24 hours a day, 7 days a week. If you get into a situation and you don't know where to go for care, I would pick up the phone and call the nurse line. They're going to ask you some questions and triage the situation and tell you where the best place is to go for care, or if you can wait till tomorrow when your primary care physician office opens. Again, this is free of charge, no additional cost to you. Blue Cross Blue Shield has some fabulous programs. We've highlighted these in your benefit guide. I did just want to highlight them as well during this meeting today. If you are a diabetic or if you have some musculoskeletal issues such as back issues, maybe it's weight loss you're looking for, or you're just trying to get healthy and find some wellness resources. These are all examples of programs that are available to you at no additional cost. Again, I would refer you to your benefit guide for more detailed information on these programs. Always encourage you to use Alex before you enroll. It's a great online tool that can help you pick the best benefits for yourself next year. I know we've had Alex around for several years, but our lives change. Maybe we have something up and coming next year, and once you go through Alex, he may suggest a different plan for you. So encourage you to access Alex every year to make sure that you are on the right plan based on your circumstances. This slide is similar to what Alex is going to be asking you. He's going to ask you, going into the future, what do you think the next 12 months are going to look like? How many office visits are you going to have? Prescription drugs. We've taken what we call an infrequent user who has employee-only coverage, and they've gone in for their annual preventative care exam. They've had a primary care office visit, had a sinus infection. They take a monthly maintenance prescription. It's generic, but that contracted rate is $20 per month. They've had an urgent care visit, and they've had a specialist visit. So we've taken the various plans that we have and how much would have come out of our pocket. You can see on the HSA plans, we're showing you those contracted rates because we have not met our deductible yet. So we're having to pay 100% of that contracted rate. And then on this monthly maintenance prescription, since we take this every day, we've multiplied that by 12. So we have a good understanding of our cost for the entire year. So we come up with our total medical cost incurred. It was $865 that we had to pay out of our pocket with either the $5,000 HSA plan or the $3,000. And on the $1,500 PPO plan, we paid $330 out of our pocket in copays. Then we have to think about how much came out of our paycheck, so that annual premium cost. And then we get free money, that employer HSA contribution for both the $5,000 HSA plan and the $3,000. So we can use those dollars to pay for our medical costs incurred. So in this example, really, we would be out of pocket $0 under either the $5,000 HSA plan or the $3,000 HSA plan and have money left over in our HSA. You'll see on that $1,500 PPO plan, we were out of pocket about $1,530. One more example, and this example is a worst case scenario. I've had an accident. I am in the hospital for a couple of weeks, and I've met my deductible as well as my out-of-pocket maximum. So you'll see here, total medical cost incurred. This is our out-of-pocket maximum worst case scenario if we're going in network for covered services. That's $5,000 on the $5,000 HSA plan, $3,000 on the $3,000 HSA plan, and $5,000 on the PPO $1,500 plan. Then we take into consideration our annual premium cost. We also take into consideration the free money we're getting from our employer in our HSA, and we come up with what our total annual cost would be. So based on this scenario, the $3,000 HSA plan was actually the least expensive for us, coming in at $1,140, versus the $5,000 HSA plan would cost us $2,000, and the $1,500 PPO plan would have cost us $6,200. Health savings account, also referred to as an HSA. By joining either the $5,000 HSA plan or the $3,000 HSA plan, it qualifies us to open up a health savings account. That HSA is our personal bank account in our name that can be used for medical, dental, and vision expenses, not only for ourselves as an employee, but also for our tax dependents. It's important to note that our tax dependents do not have to be enrolled under our employer medical plan, and we can still use our HSA dollars to pay for their eligible expenses. There is no use it or lose it penalty. Unused balances accumulate over time and roll over to the next plan year. And this is one of the only plan options where you have a triple tax advantage. Your HSA contributions are put into the HSA tax-free. As your HSA account grows, those interest grows tax-free as well. And when you withdraw the money, it is tax-free as long as you're using it for eligible expenses. There are some qualifications that you must meet in order to have an HSA. You must be covered under either the $5,000 HSA plan or the $3,000 HSA plan. Not covered under a non-qualified health plan. This includes Medicare as well as your spousal coverage. If your spouse has what we call a copay plan and you're covered under your spouse's plan, that does make you ineligible to be enrolled in the HSA. And not participating in a traditional flexible spending account, and this includes your spouse. If your spouse has a traditional flexible spending account, you cannot also have an HSA, as the IRS considers that double dipping. So you can either have one or the other, but not both. Each year, the IRS increases the annual calendar year maximum that we're allowed to put aside for tax-free money. You'll see that they've bumped that up for 2023. If I'm employee only, I can put aside $38.50. If I'm employee plus spouse, I can put aside $77.50. It's also important to note that if I am 55 or older, I actually have a catch-up contribution of an additional $1,000 that I can put aside in my HSA. We've taken into account the employer HSA contribution, and then we've listed on this far column here what your maximum contribution can be based on this information. As a reminder, that HSA is your account, it's your money. If for any reason you leave your employer, those dollars go with you. Dental. There's been no changes to the dental plan. We are continuing to offer the base and the buy-up. Both plans cover preventative services at 100%, and the deductible does not apply. Both plan covers basic services at 80% after deductible. So that means I have to meet my $50 individual deductible first. Then Blue Cross and Blue Shield picks up 80%. I'm responsible for the remaining 20%. Both plans cover major services at 50%. The deductible is the same, as well as the annual benefit maximum of $2,000 for both the base and the buy-up. If you or your children need orthodontist services, if you need some braces, that's going to fall under only the buy-up plan. So I encourage you to sign up for the buy-up plan if you or your dependents need those orthodontist services. Here are your rates. There has been a very slight increase to these rates. I do want to remind you to utilize an in-network dentist if possible. If you utilize an out-of-network dentist, you will be subject to usual and customary charges, and you will probably be balance billed if your dentist charges above what we call the 90th percentile. Vision, there's been no changes to the vision. The plan is staying exactly the same, and the rates have stayed exactly the same. Encourage you to utilize these benefits. As a reminder, if I go in today for my eye exam, I pay a $10 copay, but I have to wait 12 months from today's date to have my next eye exam. No changes to these rates. These are exactly the same as you're paying today in 2022. The lifestyle spending account, as well as the dependent care account. The dependent care account, this is for individuals that are needing care for children who are under the age of 13 while you and your spouse are working, or your spouse is looking for work or going to school full time. You can contribute up to $5,000 on a tax-free basis. Eligible expenses include things such as daycare, before and after school care, summer care, as long as it's not an overnight camp. Your dates of services must be from January 1st, 2023 through December 31st, 2023. This is a use it or lose it account. That means that if you elect to put $5,000 into the dependent care account, but you only come up with $4,000 in eligible dependent care expenses, you would lose that $1,000 if you do not have the receipts to justify to be reimbursed that money. So please be very careful on the dollars you're putting into your dependent care account, and make sure that you will be using those funds throughout 2023. You have a great employer that provides you the lifestyle spending account. This is a benefit in which your employer is setting aside money for you to use on eligible expenses related to physical, financial, and emotional well-being. For 2023, all team members will be receiving $1,000. That's going to be funded twice throughout the year, $500 funded on January 30th and $500 funded on July 30th. To enroll, you must call the 800 number. Eligible dates of services will be January 1st, 2023 through December 31st, 2023. This is a use it or lose it account as well. Funds do not roll over. You must submit your receipts for reimbursement by December 2023 to access your funds in the 2023 plan year. We've listed some of the eligible expenses. For example, exercise equipment, annual park passes, gym, health club, fitness studio. These are just some of the examples of eligible expenses. Life AD&D, voluntary life AD&D, and disability benefits. New this year, effective January 1st, 2023, you will receive a $75,000 basic life and AD&D insurance at no cost to you. This has been an increase. Your employer was paying for a $50,000 policy, and they have bumped that up this year for you to $75,000. Again, that's basic life and AD&D. That AD&D means accidental death and dismemberment. God forbid something happens to an employee and they die in a car accident. Their beneficiary is actually going to receive $75,000 in basic life and another $75,000 in that AD&D insurance for a total of $150,000. If you currently have the voluntary life insurance today and you want to keep that the same, that's fantastic. As you're going through your online enrollment process, you will just continue to re-enroll in those benefits. If you are a new hire, you will be eligible for the new hire guarantee issue. If you are just electing it for the first time or wanting to increase your current voluntary life election, there will be the requirement to complete some medical questions. You work for a great company that provides you both short-term and long-term disability at no cost to you. We often take this type of insurance for granted until the time comes that we need it. Another way to think about disability insurance is income replacement. If I become disabled and I can no longer work, disability insurance is going to help replace my income during this time. For short-term disability, you have to be out of work for 14 days due to an accident or illness, and then the plan would start paying you 60% of your earnings up to $1,500 per week. You potentially are going to receive this benefit for 11 weeks, or it could end earlier if it's physician determined. Then it rolls into what we call a long-term disability. With long-term, it's a 90-day elimination period, but that's being satisfied with the short-term disability. Your benefit amount is 60% of your earnings up to $6,000 per month. This can potentially last until Social Security normal retirement age, or the benefits would end earlier if it was determined by a physician that you were no longer disabled. Worksite benefits. You have the option to purchase a voluntary accident plan. With this voluntary accident plan, it's going to pay you a cash benefit if you or your covered dependents were involved in some sort of accident. I personally have a plan similar to this. I have a teenage daughter that plays sports, and typically once a season, she is in the urgent care or the emergency room for some sort of situation. Our most recent was a concussion. So we went to the urgent care and received $150 for that urgent care visit. plus another 150 because she got diagnosed with a concussion, plus another $50 for the x-rays that she had. So she had a total of $350 that I received a check back to me from the accident plan. I can use that check at my discretion. I can use it towards my deductible. I can use it to take my daughter on a shopping spree. Again, that's just a cash benefit. This is different than medical insurance, and it does not replace the medical insurance. It's a cash benefit that I can use at my discretion. The next benefit is critical illness. You'll see the covered illnesses listed on the screen, things such as invasive cancer, heart attack, stroke. As an employee, you elect a benefit of either $5,000, $10,000, $15,000, or $20,000. Your spouse and children can be covered as well, and they would receive 50% of your benefit amount elected. If you are insured under this plan and you have a heart attack and you elected a benefit of $10,000, then I would receive a check back for $10,000. And again, I can use that at my discretion. I could use it to offset my medical bills. I'm probably not going to be working full time during that time period, so it could help me supplement that I wasn't getting a paycheck. Both the critical illness and the accident plan have a wellness benefit for the employee and the spouse. It is a $50 wellness benefit. If you're currently enrolled in these plans today, I encourage you to take advantage of this $50 wellness benefit. You know, going and getting your annual adult physical would satisfy this requirement, and you would just fill out a claim form, mail it in, and you'd get a $50 check back. Again, this is a wellness benefit. These are some of the wellness tests that are included, but not limited to. There's even a longer list out there. These are just some of the common things that we see people being paid for under this wellness benefit. You also have the option of pet insurance. Pet insurance is through Nationwide. We have included the website as well as the phone number if you're interested in this. It can reimburse you either 50% or 70% on your eligible vet bills. You have preferred pricing, and you can use any vet. There's no network or the need for pre-approvals. Enrollment. We are having what we call a passive enrollment this year. If you're happy with your current benefits, then your benefits will automatically roll over for the 2023 plan year. The exception, of course, is the dependent care FSA elections. If you want to re-enroll in those, you must physically go into the website and re-enroll for dependent care FSA. We're going through Workforce Now on the ADP site again for enrollment purposes. We have the steps to your benefit enrollment. We encourage you to review the benefit guide. Step 2, use Alex. Let him help you decide which plan's best for you. If you still have questions, please reach out to us. We're here to help. We have the Benefit Advocate Center contact information listed. And then log into your ADP Workforce Now and make your benefit selections. If you're adding a dependent, please be sure to have your dependent documents ready to upload, things such as a marriage certificate or a birth certificate. And be sure and update your contact information in ADP. Maybe you've moved, gotten a new address. Be sure and update that so we can send you your ID cards directly to you. Thank you so much for attending today. If you have any questions, please don't hesitate to reach out to us.